Washington.
Well, across our state, emergency rooms are back to their original purpose. Joining us to bring us up to date is Dr. Anuj Vohra, Chair of Emergency Medicine at Charlotte Hungerford Hospital in Torrington, part of the Hartford Healthcare Network. Doctor, welcome.
Thank you. Thanks for having me.
Thank you for being here. So what is the volume of patients that you're seeing at Charlotte Hungerford in your ER?
We're seeing about 90 patients a day, which translates to just around 30,000 patients a year. And that's at our main campus. At Charlotte Hungerford, we have two emergency departments, one in Torrington, the other is in Winstead. And Winstead, we're seeing about 8,000 patients a year.
Are you seeing something interesting with patients who may be scared to go to the ER for fear of exposure to COVID, when in fact they may explain what you mean about that?
Sure. I think that's a great topic, because what people don't realize is waiting at home when you have an illness of concern will only lead to you getting sicker. And our emergency departments have never been safer to come to. They're clean, they're disinfected, we have private patient rooms, we're not utilizing any common spaces. So it's extremely safe for patient care. And it really leads to better outcomes. We've seen excellent outcomes for our COVID patients. Most of the patients that have been seen in our ED have been discharged home safely, and we have excellent throughput processes, meaning if you come to our emergency department, on average you wait less than 10 minutes to see a provider. So you're quick in, and if you're safe to go home, you're quickly discharged, so we can get you where you want to be. So you're going to have a clean experience that's safe for you.
When people get there, that's a great wait time, by the way. When people get there and see that it is safe and the areas are, in a safety, being treated in a safe way, are they pleasantly surprised?
Yeah, we've gotten some wonderful feedback from our patients. Our Press Ganey scores, which is our patient satisfaction, have never been higher. People really appreciate coming into a safe environment where they were once fearful of COVID, and now seeing that they're going to be extremely safe, taken care of with high-quality providers, and in a really great environment.
Wow, great ratings in this time. That says a lot. And what is your advice to patients in terms of safety measures being taken, to the public out there who might be putting off going to the ER?
Well, I think that we're very lucky to be in Connecticut, which is a relatively low-risk state, looking at other areas of the country. But we still need to maintain our social distancing of 6 feet. We should be wearing face masks whenever we're around people. And if you have an illness or you don't feel well, come to your local ED. Don't wait till it gets worse. You'll be surprised how many people have been found to be COVID positive without any symptoms. One of the unique things we're doing at Hartford Healthcare is we're testing every patient that comes into our ED, especially those being admitted, even if they have no COVID symptoms, to ensure that they're safe. And we're finding some people that had no symptoms whatsoever being positive. So we're going to make sure that you're healthier when you leave here by making sure you don't have any concerns of illness.
All right, Dr. Anuj Vohra, thank you very much for being with us today. We appreciate your time.